Good morning, everyone. It is Friday, December 17th. I'm Jessica Lovell. We welcome you into a special news and community conference with public health and hospital officials to warn about a rapid rise in COVID-19 cases. Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, will briefly set the stage for why this conference was needed. He will then introduce each official on this virtual conference for them to then share their inpatient statistics. Next, reporters will have an opportunity to ask questions while I take questions from the community. Community members, you can put your questions in the YouTube and Facebook chats, or you can email them to Medical News Network. Those links are right there on your screen. I will now turn this over to Dr. Steve Stites.
Jess, thank you. I want to share several graphs with you because I think it begins to frame the story we're going to talk about today. First of all, the hotspot map. We've talked about this before. If you go to the New York Times website, free and open to the public around COVID-19, you can see the progression of this map. If you look at Kansas and Missouri, we're as bad as we've been throughout the entire COVID-19 pandemic. And the hotspot map especially refers to those who are unvaccinated. Next slide. This looks at the risk here in Kansas and Missouri. Purple is bad. Light yellow is good. We don't see any of that on the map. What we see instead is purple and orange, the two highest levels. And unfortunately, it reflects the large number of unvaccinated patients we still have and the widespread community transmission of COVID-19 that we're seeing and the high test positivity rate in our area. Next slide. This is a slide that talks about how hospitalizations are spiking. And you can see, look at the rise, look at the steepness of the rise. And you can see in this map, we're right back where we were last fall and really on our way to where we were last winter. Next slide. This demonstrates how rapidly our case numbers are rising across our area. It's now higher than it was earlier this fall. Folks, this is what you have to understand. As the weather got cold, masks came off, we still have a lot of unvaccinated folks. We set ourselves up for danger. And that danger is real, it's present, and it's at our doorstep. This is a warning to all of you. We are in trouble, and we're going to help you understand that by talking to different chief medical officers throughout our community. What I'm going to do is first introduce Dana Hawkinson, our own Medical Director of Infection Prevention and Control here at the University of Kansas Health System. Dana, how are we doing today?
You know, we're not doing too good. For about the past week or so, we've been in the mid-40s for active infections today. We have 45 active infections, with 13 of those in the ICU and 9 of those on the ventilator. Of those 45 active infections, we have 7 that are fully vaccinated. So that is 15%. That's a little bit higher than the national. We were down to only 2% or 3% that were fully vaccinated, but this story continues to be the vast majority of people in the hospital are unvaccinated. Just to put that into perspective as well, the 45 active patients, 2 weeks ago we had 31 active patients, and 1 month ago we had 18 active patients.
And when we look at the ones who are vaccinated, it's been, most of them have not even had their booster yet. So Correct. That's an important part of the story. I'm going to turn now to each of the chief medical officers who are here with us today. This is a really great group of folks. We've been working together incredibly well throughout this crisis. I'm going to start with the chief medical officer at Advent Health Shawnee Mission, Lisa Hayes. Lisa, how are things going in your hospital today?
Well, I have to report that things are trending up just like they are for the rest of the city. Yesterday, at the end of the day, we had 37 active infections. That's up over the last month. We reached a low point of 12 infections active mid-November. Of those 37 active infections, 7 are in the intensive care unit and 6 of those are ventilated. We have 4 who have cleared their infections. Of those that are active with their infection, only 4 are vaccinated. And that's typical for us. Usually in the 80s to 90% of our population are unvaccinated. And I'm sad to report that since the beginning of December, we've had 13 deaths.
Yeah, a lot of deaths. We know that 1 in 400 patients or so has died, or 1 in 400 people in Kansas, the Kansas City metropolitan area, have died with COVID-19. Right. That's a terrible statistic. Dr. Jennifer Watts is the Chief Emergency Management Officer at Children's Mercy. What's your patient story there, Jen?
Yeah, today we've had 14 patients in-house that have acute COVID. 3 of those are in the ICU. Over the last couple of weeks, we've seen a dramatic increase in our outpatient and overall positive cases, as well as our inpatient cases. I can say overall in our testing, which includes all of our ambulatory settings, our drive-through testing clinics, we went from 200 positives just 2 weeks ago to over 400 positives. And the impact on kids and their entire families and being in school, it has a large impact beyond the hospital setting too. So definitely an increase in the pediatric population.
Yeah, these are tough moments. Dr. Kim Megow is the Chief Medical Officer for HCA Midwest Health. Kim, how are things?
And 51.
Hey, Kim, you might need to unmute. Go ahead, start again.
Can you hear me?
Now we can. Go for it.
Okay. I'm sorry to report that we have this morning in the HCA Midwest Health facilities a total of 151 COVID positive patients. That represents 14% of our inpatient volume this morning. 30 of those are in the ICU and 12 of those are on ventilators. Only 3 of those 30 are vaccinated, so it continues to be a very small portion of our patients who are vaccinated. We are experiencing quite a bit of stress in the system, as all of the hospitals are in this area, related to other bed availability and staffing needs. We currently have 43 patients holding in our ERs waiting for inpatient beds. We have no med-surg capacity this morning, no beds available, and only 12 ICU beds across the market are available this morning. So really tight bed capacity as well as staffing. And unfortunately, our death rate is over 11% for COVID patients. And just to give you a little perspective, we've had more than a tripling of our COVID volume in the last 3 weeks. So it is very alarming. We're trying to keep a close eye on that and doing the best we can with making beds available.
Thank you. That is an alarming statistic. Tripling the volume in the last few weeks is really bad news and some of the sharpest rapid rises we've seen throughout this pandemic. Dr. Raghu Adiga is Chief Medical Officer and Infectious Disease Doctor at Liberty Hospital. What are your numbers like?
Thank you. We at Liberty, for the past week or two have been alerting everyone in the city as Northland started seeing the surge a little bit ahead of elsewhere in the city. We currently have 33 inpatients, 29 of them are active in isolation, and 5 in ICU and 3 on the ventilators. And of these 33, nearly 90% are unvaccinated. And for the past couple of weeks, all 100% in ICU, all 100% on ventilator have been unvaccinated people. We haven't had to cancel any routine care or surgery yet, but had to ask more and more of our already tired and overworked staff to take care of patients in overflow areas like everywhere else. We just want people to help us take better care of them.
Absolutely. Dr. Jennifer Schrimsher is the infectious disease physician at LMH and Deputy Public Health Officer for Douglas County. What numbers do you have to share this morning, Jen?
Thanks, Stites. We have 13 total. 5 of those are in the ICU. I believe we have 2 recovering. Of all of those, only 2 are vaccinated. Neither of those are in the ICU. And they both have multiple chronic medical conditions. We remain closed to outside transfers, so nobody outside of Douglas County. And we're still trying to get staff to take care of patients. We've been looking at bringing people in from outpatient areas to try to help with the inpatient volume. Not great, but glad to be here. Thanks.
Yep. Thank you for being a part of the program today. Dr. Jim Stewart is the Chief Medical Officer at North Kansas City Hospital. Dr. Stewart, how are the numbers there?
We are up like everybody else is. We have 90 active infections now, 16 that are out of isolation for a total of 106. 12 are in the ICU and 4 are on ventilators. And we're running 85 to 90% of those in-house that are unvaccinated. And just for context, December 1st, we had 45 active infections. Today we have 90. November 1st, we had 19. And today we have 90.
That's a terrible number, frankly. That's an incredibly rapid rise. And what's concerning, too, is that high rate of the acute cases versus the recovering. Just reflecting what you've said, Dr. Stewart, the rapid rise you're seeing is high as we've seen throughout the pandemic. Dr. Mark Steele is the Executive Chief Clinical Officer at University Health. Dr. Steele, what are your numbers like today?
Yeah, so Steve, here at University Health today, we have a total of 62 in the hospital. That's nearly 20% of our total bed capacity. 46 active and 16 are recovering. This is double the number of patients we had a week ago and 6 times higher than we had a month ago. 14 are currently in the ICU and 6 are on ventilators. One of the patients on a ventilator is in their mid-20s. Nearly 90% of our admitted patients are unvaccinated, and none of the patients that we currently have on a ventilator are vaccinated. We've unfortunately had 9 COVID deaths so far to date this month. Both our hospitals are running very full, and we're currently holding 7 admitted patients in our emergency department awaiting a bed.
The pandemic of the unvaccinated continues. Dr. Elizabeth Long, Chief Medical Officer with Olathe Health. How many COVID patients are you all caring for today?
We are up to 41, which is almost our high from last year. And to give some perspective, that is 27% of our bed capacity. We have 4 in the ICU and 2 are on ventilators. And like everybody else, 90% of those patients are unvaccinated. We are struggling with our staff. They are tired. They are overworked, and we continue to ask them to do more and more with these volumes. And so we are anticipating issues with our travelers. Their contracts are going to be expiring, and they were wanting to renew their contracts in January. So the next few weeks are going to be critical as far as the ability to take care of patients.
And I appreciate your mentioning the staff, because we know people are tired. These are hard days. Dr. Jackie Hyland is Chief Medical Officer at the University of Kansas Health System at the St. Francis campus. Jackie, are you available this morning?
I am. Thank you. So we have seen a steady rise in our cases here at St. Francis as well. Several weeks ago, we were in the 5 to 8 range. Today, we are at 21. 2 of those are ventilated, and then the other 10 do have significant respiratory support with vapotherm and BiPAP. The rest are on the medical floor. About 80% of those individuals hospitalized currently are unvaccinated, and we have been at capacity, I would say probably 90% of the time over the last 3 weeks, with being on community diversion with both hospitals in Topeka being full. We are also short-staffed, using a lot of agency nurses, and also seeing a lot of retired nurses coming back to help in multiple different areas across the hospital. The other thing that we're seeing in Topeka is difficulty discharging patients back to the nursing home due to their staffing shortages as well. And so that, it causes a backup all the way through to our emergency room, and holding emergency room patients. They're preventing them from getting admitted to a hospital bed. Every morning we've been having about 5 to 15 holding in the ED, which is very unusual for us at St. Francis, but not in the last several months. And it's due to the staffing shortages, and then now seeing those numbers rise.
And Jackie, you mentioned earlier this week you all had canceled some orthopedic cases because you didn't have enough staff and enough beds.
Correct. Mm-hmm. Yeah, we had 12 patients holding in the ED, and we did have to unfortunately cancel and reschedule a total of 8 surgeries, inpatient surgeries, being very flexible, trying to get those in on, Thursday, Friday, Saturdays, when we can.
Yeah, I think this rapid rise has got everyone concerned. Dr. Ma Batrash is the Chief of Staff at the Kansas City VA. How are our veterans doing, Dr. Batrash?
Today, we have 17 inpatients with active COVID. 5 of them in the ICU. All but 1 are unvaccinated, those in the ICU, and none on the vent. We have also 12 in med-surg beds. Of these, of the med-surg, so the less sick patients, 50% are unvaccinated. Last week, we actually lost 3 veterans to COVID, and all 3 of them were unvaccinated, unfortunately. That's the status here. So it's the numbers, just to give you perspective, more than doubled since last week and more than tripled since last month for us. So currently we have 16% of our census with active COVID.
Yeah, this is really concerning, Hawkeye. A couple of quick points. A, we have tripled since last month. You hear that message consistently. B, it is a pandemic of the unvaccinated, especially in the ICU, and 100% on ventilators. C, not only is there a rapid rise, but we have to be confronted by this rise of Omicron. In New York City, currently they are now at their 3rd highest rate of new cases throughout the entire crisis. Remember those terrible images from New York City back at the beginning of the pandemic? They're at the 3rd highest rate, and that is fueled by Omicron in New York City. Yeah. So we know that's coming here next. So we have masks off, people coming indoors, cold weather, and the rapid rise in COVID-19. Against the backdrop of we still have influenza, we still have RSV, we still have parainfluenza, and all the other diseases. Hospitals are full. There's no place to go. Our staff are tired. We're going to run out of travelers, and Omicron is at our doorstep. This is a tornado warning to our community, Hawk.
Yeah, absolutely. I think that's a great point. What we're seeing with hospitalizations right now is an effect of the last 2, 3, 4 weeks with Delta. So you're exactly right. But we know, and as you said, it's a pandemic of 2 different populations, vaccinated versus unvaccinated. The unvaccinated are going to continue to bear the brunt of this pandemic.
Let's see if there are reporter questions on the line. We're here to answer your questions. All right, not hearing any Jess. I'm going to turn back to you. Let's take some community questions. Oh,
did someone just jump on though?
All right, go.
Hi, good morning. Lily with KWCH in Wichita, Kansas.
Good morning.
Couple of questions. Wanted to know, of those who are being hospitalized, are these first-time infections to coronavirus? And if so, are you guys tracking reinfections as well as breakthrough cases?
You bet. Great question. Let's turn to Dr. Kim Megow, the Chief Medical Officer at HCA Midwest. Kim, what are you seeing with the HCA hospitals?
The vast majority of the infections we have right now in-house are initial infections. It is somewhat difficult to track the breakthrough infections as information is not all located in a central place, but most of the patients we are seeing right now are initial infections.
And Dr. Jennifer Watts at Children's Mercy, do you track that question?
We do not. I would say most of what we see, though, are initial infections from people coming in, but we also don't have a central place for all children. I will also say most of our children are unvaccinated that are testing positive. We do track our vaccination rates for everybody that comes through our system, and even in our outpatient drive-up testing, and the majority of those are also the unvaccinated. And there we don't know, though, if they are the initial or repeat infections.
All right. Other questions?
Hi, this is Celia with the Kansas News Service. Some months back when the Delta surge was at its worst, before, of course, hospitals were getting calls from other hospitals in other states looking for beds and having to spend hours also looking for beds. I'm just wondering where that situation is right now compared to before.
You bet. I know we're getting calls from Michigan and Minnesota and other places. So, yes, we're getting calls from other states. We don't have beds. Dr. Lisa Hayes, I see you shaking your head. How does that shape up with Advent?
That's exactly in line with what we're seeing here. Calls from throughout states around Kansas City, Minnesota, Oklahoma. A large part of the week for me has been spent helping manage how to juggle all those transfers that need to come from outside hospitals and freestanding hospitals. We're in a bed crunch.
Dr.
People
Stewart
aren't able to get in a timely manner.
Dr. James Stewart at at North Kansas City Hospital. How is your transfer center doing?
We're in the same. We have the same problem. We get calls from Arkansas, Oklahoma, Texas, Nebraska, and we just don't have the beds to be able to accept these patients. And we are full, and there's definitely a bed crunch.
Yeah, Dr. Batrash, I saw you shake your head yes as well. It's got to be a difficult question when we don't have beds for veterans.
I agree, and we do get transfer calls from the outlying facilities and rural areas, and we do have a bed crunch, no question about it. We went on bed diversion several times in the past couple of weeks, and yes, we continue to have bed crunch as well.
Yeah, just to say, I know we normally try to accept, we do accept about 65 to 70% of all transfer requests. We're down under 30% in the low 20s now. We simply don't have the beds to accept patients into. And even if you have a bed, sometimes it's very difficult to find staff. So these are difficult times. And again, a warning to us all that if we're not going to try to bend the curve's going to bend us. Other questions?
Dr.
Steve?
Stites?
Yes.
Oh, I was going to address the earlier question a little bit about
Please.
the reinfections.
Please.
The one important thing I think people need to pay attention to, so far we have seen few reinfections, and mostly in immunocompromised and people who have been, fairly long time after the initial infection. That's going to change when Omicron is going to be here. I think people need to pay attention to that. It's going to be really, really different, and reinfections are going to be very high.
Yeah, and I think there's some ideas out there, Hawkeye, that this is not going to be as severe with Omicron. The reality is we don't know that that's true because it's been in younger populations, which tend not to be hospitalized that much. But to Dr. Adiga's point, Omicron, or prior infection, really doesn't protect against Omicron. We saw that in South Africa, and as we hit older populations, we don't know what's going to happen.
Yeah, I mean, I would like to say, what we have known historically about reinfections is it tends to be rare or very infrequent, but it also has to do with the timeout from that first infection as well. And that was part of also some of the South African information about Omicron and mild illness. It's very difficult to tell with a younger population. Many of those people probably were infected recently with some of those other variants that have been going around as well. So I think that's a good point.
When to follow up on that with Dr. Mark Steele for just a moment at University Health. Mark, you all had a lot of monoclonal antibody infusions that you've been doing, and again, you're going to be a center for more of that coming from the state of Missouri. But it also looks like that most antibodies won't work against Omicron. There's only one that really is going to work. Talk to us a little bit about what you see. That puts us in a bit of a difficult situation.
Yeah, I think there's no question about that. I mean, obviously, we are seeing a high demand for monoclonal antibody infusions. We're doing our very best to keep up, but there's more demand than ability to give the infusion. Staffing is our biggest challenge, and there's a little bit of challenge in getting the monoclonal antibodies themselves. But obviously, Omicron is going to potentially change everything and may render these current infusions not as effective.
And I think, as we see this, and Omicron comes in the midst of this pandemic, and people say, well, it's February. No, it's going to be January. I think it's probably already here in our community. Yeah. We can expect to transmit it very rapidly. And here's the other problem, and we need to hit on this too. When we're out of beds, we're not just out of beds for COVID patients. Yep. We're out of beds if you're having a stroke or heart attack. If you have that car accident, we know earlier in this crisis, we couldn't find places to take care of trauma victims. You couldn't find places to take care of stroke patients. This is really serious, and we're sending this warning to you so you have the warning and you can prepare and you can help us bend the curve. If our community chooses not to do that, we will bear the consequences of it because we can't make more beds. They don't come right out of a box and say, oh, let's now take care of all these folks. And all of us, all of our patients, all of our families will suffer if that's where we are. Other questions?
Steve?
Please, go.
Yeah, I just wanted to say that I think that with Omicron coming, that even people who are fully vaccinated, it's important to note that getting a booster significantly increases your protection against Omicron.
Yeah, so true. Excellent point. Other questions?
This is Celia again with the Kansas News Service. How would hospitals overall compare the staffing levels now to, say, a year ago when we were dealing with that first initial awful, winter surge?
Oh, that's a great question. Dr. Long, let's start with you. How would you compare now with a year ago at Olathe?
What I would say is that the at the beginning of the pandemic, it was like going off to war and everybody was all about it. And the energy level was high and we were wanting to really, really take care of this and end it. This has just been an ongoing marathon of trying to continue to balance other health conditions as well as COVID with this. And what we saw was a lot of healthcare providers, mostly nurses, chose to leave the profession. The nursing classes are only graduating about half because they don't have the nursing instructors. And so we are at this great pinch in that we don't have the nursing staff to help take care of these patients. And they're tired and they're worn out and they're seeking other opportunities. Some are staying home to educate their children. And so we are at a big crossroads here to where we all want to be done with this. We all want to be done, but we're not. And so we are definitely in a dire situation. And we're trying to even get foreign nurses in. But unfortunately, from an immigration standpoint, they're a level 4. So we are not able to try to even import some help as far as what we need to take care of our community.
Yeah, that's a great point. Dr. Kim Megow, HCA has a lot of beds in Kansas City. How's your staffing?
Yeah, thanks, Steve. Our staffing is really tight. And I would say, in answer to the reporter's question, the current surge, we actually have a much worse staffing situation than we did last year during the previous surge. And I think that has a lot to do with people getting burned out and also seeking other opportunities inside and outside of healthcare. And I would say it's our limiting factor. We have some physical beds in our system, but we don't have nurses to take care of patients in those beds. And we can't use them. So our capacity is really limited by the staffing shortages that we face. And like the other physician said, we have gone outside of the country to hire nurses. We have pulled nurses in from other areas within HCA outside of this market. We have hired temporary and contract nurses from various places. And it is not only a daily struggle, it is an hourly struggle. Every hour, we are constantly monitoring how many nurses we need, how many can we get, when can they get here, how long can they stay, what do we need to pay them. It is a constant conversation, and I can't stress enough to the folks who are in the community and in the media who are listening, this is a serious crisis. And other patients without COVID who have serious healthcare needs are also facing that crisis because they too cannot get into a bed. It's not just the COVID patients who are not able to get the care locally that we would like to provide.
Yeah, the lack of action by all of us hurts all of us. Dr. Hayes, please go.
Yeah, I was just going to say at North Kansas City, we look back a year ago, and this same week in December in 2020, we have now 20 patients more acute than we did a year ago, and we didn't peak until mid-January. So if this continues, we're going to beat our previous peak, and we are short on beds, we're short on staff, and it's going to be tough.
And I just, I can't emphasize enough, we haven't seen Omicron. We're in the middle of a Delta exacerbation. Omicron is here. It is at our doorstep, and it is going to blend in with these Delta numbers. Dr. Hayes, how are things staffing-wise at Advent?
Yeah, just echoing what everyone else is saying. I mean, the beds are not the issue. It's the nurses to staff the beds. And that creates such a backlog throughout the system that prevents people moving up from the ED. So they're holding in the ED for hours, sometimes days. Then they're holding in the waiting room for hours. They can't be transferred from outside EDs. It's just a huge backlog, and it's all created by rising COVID numbers and burnout. Our nurses are burnt out. They're tired.
Exhaustion is a real thing. Other questions?
Hi, Joseph Hernandez with the Kansas City Star. Just curious, what are some precautions people should be taking prepared for Omicron? Like, do you have any advice on shifting holiday plans or like things like that?
Well, we know out in New York we're seeing cancellation of Broadway shows again, cancellation distancing again, more masking again. I mean, it's all coming around just like it has before. So, Dr. Schrimsher, you're an infectious disease physician. What other advice would you have?
I mean, it's the same things we've been saying since the beginning. The two most important things are wearing a mask and getting vaccinated. And for those who got vaccinated, make sure you get your booster. I would be rethinking what you're doing for the holidays. I would look for smaller gatherings, trying to stay with your own household, not traveling across the U.S. You know, if it's nice, open the windows, wear your masks when you're not eating. All of the things we've been saying since pretty much day one. I have also tried to shift into those things, because we all know those things. We've been saying them for forever. But maybe try to think more about not just yourself and the risk to yourself, whether or not you're going to get infected and whether or not that means, you know, kind of a risk benefit. Do I want to go to this party? Well, I'm young, I'm not going to get sick, or I'm not going to get that sick if I do catch it. To try to think more about those that are around you. So who's in my household? Do I have someone older in my household? Am I planning to go visit my grandmother for Christmas? My coworkers, does my coworker have someone at home who may be immunosuppressed, getting chemotherapy? Try to be more cognizant of those around you and their risk as well, and not just your own.
Dr. Adiga, you're an infectious disease doctor. Anything you have to add to Dr. Schrimsher's excellent comments?
Yeah, I agree with what she said. I would also add, of course, it's too short a period for the Christmas days now in terms of vaccination, but Omicron is going to be here within weeks. So I think focusing on the vaccinations as well, people who've gotten the primary series, they really ought to get up and go get their boosters as quickly as they can. There is no question about that. And of course, if you can get the test, the rapid test, the day of the Christmas gathering, I would recommend that even if you are vaccinated, especially if it is more than 6 months ago, the cost of those tests are coming down. You can get a 2-test combo for $14 now. So I would strongly recommend getting the test, especially if you are a high-risk person or if you live with a high-risk person. I recommend testing.
Okay.
Yeah, I mean, I think we just echo all of that. You know, it is levels of mitigation. It is different things. It's understanding you as an individual in your bubble, just like we've heard. It's understanding those high-risk situations that you may be going into. So it continues to boil down to those non-pharmaceutical interventions, assessing that risk, understanding about masking, about well-ventilated areas rather than indoor areas, distancing, hand hygiene. But of course, as we heard both of the doctors say, vaccination. Vaccination helps. If you haven't received your primary series, please start and go get that. Get influenza vaccine as well. If you are in that criteria for getting that booster, please get that booster dose.
Dr. Jennifer Watts at Children's Mercy. Masks are coming off in schools. What does that mean, especially with regards to the holidays and Omicron?
We are extremely concerned as we look to the holidays and in the month of January. Like everybody here, we also have staffing concerns, and we are extremely short on nursing staff. And when you look in the pediatric population with masks coming off in schools, you're starting to see in the rural area not only COVID spreading, but also influenza. We have influenza cases that have creeped in the last week or so. And a typical winter for us in the pediatric population is the huge spread of flu and other winter viral illnesses. So with masks coming off in school, that's an extreme risk for us to see our typical winter surge, COVID exacerbated on top of that with our staffing shortage. So with masks coming off in school, it is extremely concerning to us in the pediatric population. The other thing that I'll also add from a pediatric perspective is to remember our under 5s are not eligible for vaccine yet. Our under 5 population is still not eligible, and they are not vaccinated and don't even have that opportunity to get vaccinated. So when you also look at that population population being in daycares, when they get sick and they are out of school, that has a huge impact on families trying to go to work and trying to maintain their jobs. And it also takes our nursing staff out of the workforce when they have to stay home with their child because they're sick, because they're not eligible to be vaccinated yet. So we are concerned as a whole for the pediatric population.
Dr. Schrimsher, did you have a follow-up, I hear?
Yeah, I'm sorry. So I think a lot of people think that monoclonals are available as kind of almost a safety net. Like if I get infected, I can just go get an infusion. But there isn't any. We were doing around 60 infusions a week, and our allocation for this 2-week period was 6. So Kansas only received, I think, 1.4% of the nation's supply of monoclonals currently. And I know a lot of hospitals on this call also do not have any. So we may not be able to offer that if people do become infected around the holidays.
And I want to turn to Mark Steele at University Health. Mark, your hospital serves a really underprivileged or an underserved population. You've got to really feel the concern about folks being at risk.
Yeah, no question. I mean, as you mentioned, we do serve a significant underserved population, and we know those folks are at risk for severe disease and potentially dying. And so, and as we see people die currently, I mean, it really is heartbreaking, quite frankly, because we know that these are largely preventable deaths. And so, it's somewhat mind-boggling that more people aren't taking the vaccine. And so I guess the message clearly is, and as others have mentioned, is it's not too late. If you haven't been vaccinated, get vaccinated. And if it's time for your booster, please get your booster, because we see things on the horizon not looking too good, especially with Omicron on our doorstep. So that's, hate to sound like a broken record, but that's really the most important thing that people can do. And then obviously masking and social distancing, as we've heard.
Other questions from reporters?
I had one more. I wonder,
Please.
Is it possible, in terms of the number of people being hospitalized each day, are you able to kind of predict where a ceiling will be and at least say, for example, that it won't get as bad as a year ago because some of the population has already had COVID or already been hospitalized, or already been vaccinated?
I don't think we can say that, and here's why. First, there have been a lot of time that's elapsed between some people who've been vaccinated and those who are getting sick, and now. And what we know is, for example, the patients who are vaccinated and in our hospital are all people who haven't had boosters. And so the second thing is that if you look at the Omicron rise, it hits hard in the unvaccinated and if you haven't been boosted. So I think that's going to be another wild card we face. And third, this has been an unpredictable pandemic. What we can tell you is that if you've been vaccinated and boosted, you're probably not going to die, and you're probably not going to spend time in the ICU, because we see that data is overwhelmingly true, and it looks like it's going to be intact for Omicron. But otherwise, I don't feel good about saying that at all, and here's why. The numbers are already rising as fast, if not faster, than at any point throughout this crisis. So if we could have comfort because you'd already been infected, what we have to say is it's not bringing comfort right now. It's not bringing comfort to the patients who are hospitalized. And remember, this is now truly a pandemic of the unvaccinated, and it is a death march of the unvaccinated, right? Remember to keep that in context. It's not just about being hospitalized, it's who's dying. If 1 in 400 people in Kansas City have died from COVID-19, where are we going to end up? What's that number going to be? Because what we know is it's going to be numbers from the unvaccinated, and we know what the steps are to protect each other. We know what we have to do. It's hard. It's painful. We don't want to keep doing it. We're all tired of COVID-19. I get it. But I'll tell you what you're going to be more tired of. You're going to be more tired of the death from COVID-19, and you're going to be even more tired of people who can't get a hospital bed with a stroke or heart attack or a trauma or anything else because of our rapid rise in COVID-19. So that's what we have to try and steer away from. We know how to do it. We know what the rules are. We know how well they work. We're not We're not publicly elected officials in this group. We are folks who try to take care of folks in the hospital. We have a singular goal here. Our goal is to get you scared straight, because right now we're not seeing it. We're not seeing it in the public. And what we know is we're in trouble. And you need to hear that we're in trouble. You don't need to hear that, okay, everything's going to be okay, because the reality is it's not okay.
Steve, I'd like to add something to that.
Please.
I just want to keep our eye on the ball as well, because we are taking care of all the patients. And I think throughout the metro, we've talked about this on our calls, that the acuity of even the non-COVID patients is higher. And so it is a stress on the whole system, because people have, through the pandemic, maybe put off some of their medical care. And so the other patients that are not even COVID related are a higher acuity and increasing the stress on the system as well.
Yeah, but you're exactly right. And Dr. Petrash, I see you're shaking your head yes. So it must be true for our veterans as well.
Absolutely. We've seen really a rise in the acuity of our inpatients here. It's and there's actually a paper published about the delay in cancer diagnosis also because of this pandemic. So this is something real. You know, when we talk about lack of beds, having to delay surgeries, having to delay some important diagnostic procedures because you want to save beds or try to kind of get access to those COVID patients, COVID positive patients, that impacts the other non-COVID patients. And guess what? These cancers do not stop; they continue, and that's a big issue. That is absolutely a big issue. And for some reason, we have seen a huge increase in the acuity of the patients that we're treating here as well. Veterans, exactly the same.
Yeah, we certainly have here at KU, and Dr. Stewart, I bet you're seeing the same at North Kansas City.
Absolutely. You know, the question about whether this is going to be as bad as it was last year, like I said earlier, currently we have 20 more COVID patients in the hospital than we did a year ago. And so I think the peak is going to be worse than it was a year ago, not better.
Yeah, totally agree. And Dr. Megow, I think at HCA, I know there are times where you guys have been strapped as well, and without the right staffing and lots of patients, we've got to be a little bit fearful of what's to come.
Yes, I totally agree. We've been extremely concerned about our level 1 trauma center when there's a diversion need because we don't have beds, and it is directly related to staffing. Obviously, we can't avoid traumas from occurring out in the public, whether it's a car accident or a gunshot wound or some other tragic accident. The sad reality is we may not be able to adequately care for those patients. So that's one big concern. And I would like to mention one other concern that maybe not everyone in the public is completely aware of. The younger population, particularly young pregnant women who are generally a healthy group of people, we have seen quite a bit of really high acuity in those patients when they get COVID. We have had a number of them in the ICU. We've had a number of them have to be delivered early, and then the babies are in the NICU. And that's a real risk. And so I would like to remind everyone who's listening that pregnant women can and should be vaccinated. And we want to avoid an otherwise healthy person ending up in the ICU and having a premature baby who may not survive that episode of care either. So yes, we continue to be extremely concerned.
Yeah, Dr. Megow, thank you. That's an excellent point. Okay, other questions out there from reporters?
Dr. Stites,
please.
I think one thing that's contributing to the exhaustion is the fact that our healthcare workers, you come to us when you want to have a healthy baby, when you want to prevent a stroke, when you want to prevent a cancer, when you need treatment for a gunshot wound. Trust us. We are looking out for your best interest when we're recommending these things like a vaccine and masking. We are experts in preventing diseases. And just like you trust us when you're sick, trust us to help prevent you from getting sick from COVID too.
Yeah, thank you, Dr. Hayes at Advent Shawnee Mission. Great words. And I tell you, isn't that the story? Isn't that the whole point of this conference? Please wake up, see where we really are, and don't. There's all this stuff out in the internet and all that other things. Yeah, COVID is real. Our crisis is real. The Kansas City metropolitan area is in trouble, and we are all in it together. And if you don't have COVID and you can't get care, or if you have COVID and can't get care, both of those are bad outcomes. And what we're telling you all is, there are some times you're not going to get care right now. If these numbers continue to rise, all of our public is in trouble. And that is just something none of us Hawkeye want to see here at a hospital.
No, people think that masking and doing some of these mitigation strategies in vaccine are isolated and not linked to anything else, but they are. And if we can do those things, we can keep people healthy. We can keep them out of the hospital. We can keep schools open. We can keep businesses running, keep those clients healthy, keep those employees healthy. Because when everybody is healthy and doing those things, everything else runs better as well. And those things are not in a vacuum. They don't have to be separated from each other. And I think that's one thing. Everything can be used and working together to help keep those things going that are so important. It is people working, it's children going to school, and it's people staying out of the hospital.
Yeah, we don't want to go back to
Right.
that part of the past.
Yeah.
And again, you can see areas of the country, New York City canceling Broadway shows and
Yep.
taking other actions.
Yeah.
Football teams not being able to play next week. I mean, this is real, folks, and it's in our city, and it's going to be just that way in the next several weeks if we don't take action to bend the curve.
Yep.
Questions from other reported questions? All right, but Jess,
Yes.
are there any community questions just by chance?
Quite a few, actually.
Yeah,
and
let's
before
do
we
it.
get to those, I do just want to take a moment to thank our media partners here in our community and across the state, and our reporter partners for asking really great, thoughtful questions. So thank you, and also for media for streaming this live this morning. Just shows how
And
much.
can we say thanks to Anthony and Logan and to you and to Jill and everybody else who put this thing together, and again to all our CMOs. We'll come back to that. Thank you in a minute.
You bet. Anytime. Okay, so I'm just gonna have at it here and ask some really good questions coming in. And this one's kind of two-part from two different folks. But John asking, can someone please reconcile the reasoning for eliminating mask mandates given this recent surge? Jenna asking, what can this group do to influence local leaders and schools to maintain or re-implement mask mandates?
You know, I've been trying to reconcile that. I think people are just tired and they want to be done with COVID-19. The problem inside the hospital is we're tired of COVID-19, right? You all are tired. Everybody in the community, they're tired of COVID-19. I get it. We're tired of COVID-19. And the problem is the way we're tired is a little different because when the public is tired and they take their masks off, it makes us more exhausted. And in fact, it begins to limit our ability to give care. Dr. Adiga, other thoughts about what's going on out there? What do we do about those mask mandates?
Yeah, and of course, we are not the decision makers. We speak science, and that's all we can do. We can keep repeating ourselves, telling what's behind the science, why the masks are needed. Obviously, decision makers have to, understand the science and do what they need to do. And it's absolutely right. What they see and what we see are a little different. And what they see, if it happens in their own household, they'll probably understand. When they don't see it, and it's harder for a lot of public to fathom what it means, and we need to start looking at everyone else as it's been discussed earlier. It's not just ourselves; it's our neighbors, it's our family, it's our grandparents, it's everyone else that we deal with every day. So I think we need to start thinking a little bit more global.
So true. Dr. Jackie Hyland at our St. Francis campus, talk a little bit about how did it feel to have to tell patients that we're canceling your surgeries because of COVID-19?
So those phone calls are incredibly difficult. The OR director has had to make a lot of those the morning before, and patients are upset. A lot of them are crying and don't understand, and they have been doing a lot of different things to get organized to have surgery. Family has come in to support them. People are taking off work. So it's a big disruption not being able to do a total joint or a big surgery like that due to the beds being unavailable because of the increasing cases of COVID. So it's hard.
It is hard, and Hawk, we try to stay in our lane, right? We try to stay in our lane and talk about the science to Dr. Adiga's point. We're not publicly elected officials. We don't feel all the pressure. But what you said a little while ago is so true. If we don't do something, then our businesses and our schools are at risk.
Correct. Absolutely. Yeah, absolutely. These things do not exist in a vacuum. They do not they are not isolated from each other. They are in with each other. There's an amalgamation of all of that. They are connected. They are interconnected. We are all interconnected. And doing those things will continue to keep those employees, those children, those students, and the clients, everybody healthy. That way those businesses can continue to run. We can continue to do those things that we want to do, whether it's going to see a show or going to a concert or something of that nature, or just simple things like going out to eat.
Yeah, it's so true. Dr. Jennifer Watts at Children's, what's going to be worse, having to put people to wear masks in schools again, or not wearing masks and watching Omicron go through a school and thinking that means we're going to have to close?
We know from previously when we shut down schools the impact it had on children, and it's a huge impact on pediatric health in general. The COVID illness in pediatrics does not just affect their need to be hospitalized, but it also affects their mental well-being, their development, their nutrition status, their just the entire gamut of pediatric health. And so we know when schools are closed, it's extremely detrimental. Right now, we have a crisis in our education system, too, with kids being out of school for as long as they were and now being back in school, and the education system's trying to help them get caught back up. And the more time those kids are out of school because they have Omicron, the more detrimental it is. We know that masks work. For the schools that have been in session and were masked the entire time, there was minimal spread inside those schools. We do know that they work. There's a big push to get masks off. For the most part, it's not the children that are complaining about the masking. And there's a big push to get them off, to be in school and get the masks off and get us back to normal. And I think we are almost there. We are almost there. If we can get kids through the winter season, I'm hopeful that we will be there once we come out of the winter season. But we've got to get there first. And I mean, it scares all of us in the pediatric world that we're going to see schools shut down, that we're going to have so many kids out of school just with illnesses right now, that they're going to be affected much more from being not in school. We also know that masks are safe in kids. And so we have a big plea to continue masking as much as possible to keep our kids in school, because that's the primary goal.
I have a question, Dr. Stites from the Kansas City Health Department. With the reports from the research out of the University of Pennsylvania study with H3N2 flu strains and a potential mismatch of the vaccine, and that flu vaccination is historically low, what is the potential impact on hospital systems when you add that to the surge?
Yeah, that's going to be ugly. Dr. Schrimsher, you're an infectious disease doc. This flu, I'm worried about the influenza season upcoming.
Yeah, we hear about KU students. They've been having an issue for a while with quite a bit of flu. And then this week, we had a sudden rise in our flu cases. We had our first combo COVID flu case patient as well. This I was going to mention it if you didn't get to it. We are in a Delta surge right now. We are going to get hit by Omicron in a very short time period, and it is going to be sudden and a ton of cases with the potential for quite a few hospitalizations. And then we have influenza. And I watch people, I know a lot of you on this call do, I watch people die from influenza every year. And we do have a vaccine. Yes, it's not as good, but it still does something to reduce the severity of illness if you do get influenza, just like the COVID vaccine, because this is how vaccines work. So my other ask of my patients and the community is to get your flu vaccine. And guess what also helps? Masks. We had like a total of 4 flu cases last year. It was ridiculous. But it's just, it shows you how well the masks work. So it's the same messaging, get a vaccine and wear a mask. And I sound like a broken record kind of to the last question. I recommend masks in indoor public spaces and outdoor crowded public spaces. And I have been saying this for a while. I think that it would go a long way to preventing a lot of the hospitalizations that we're currently seeing and will see in the next couple months.
Steve,
Go ahead, Hawk.
Can I just reiterate that point, because I think the public needs to hear it again and again. Even if the influenza strain is not a very good match to the vaccine strains, what we have seen is year after year when that happens, just as Dr. Schrimsher said, those influenza vaccines continue to provide that benefit of reducing your risk of hospitalization and severe disease from influenza as well. There's still time. Please still go get your influenza vaccines.
Well, and just do the numbers. And Dr. Stewart, work with me on this one, because I bet you feel the same at North Kansas City. But if we have 30 influenza patients, and we've had 30 influenza patients before here in the hospital, you add that to 100 COVID patients, 130 beds. Okay, well, that's like 4 units of just those 2 infections. Yeah. That scares me, Dr. Stewart, because I don't know that we have that capacity.
Right, and the difference between this year and last year is that we didn't have the census of non-COVID patients in the hospital. We're full of sick people who don't have COVID, as well as all the COVID patients. And if you add a bunch of flu cases on top of that, we're going to run out of beds. So, I mean, we're already very tight, and it's going to get worse. And, I think last year we virtually had no flu, and we figured out that we know how to prevent the flu, and it's wearing masks, because everybody's wearing masks last year.
And Dr. Watts at Children's Mercy, influenza, bad news plus RSV.
Absolutely. Influenza, we always have kids in the hospital with influenza, and the vaccination rates in children for influenza this year are still down, but way below where they usually were pre-pandemic. So we encourage people to get their children vaccinated for influenza as soon as possible if you haven't done it already. We have seen a decrease in RSV cases over the last month or so, which is really positive to see, but nobody knows what this means. We had a surge in RSV in August, which is very unheard of, and nobody knows if that means RSV is just done for the year or if it's going to come back. And our gut feeling is that it's going to come back. Kids are germaphobes, and kids swap germs all the time when they're in the area. We become snot city in the winter, and so we expect RSV to come back, flu to come back, Omicron to come in, and it will be the respiratory viral season for us, just on steroids.
That leads me to my next question. Lauren wants to know, what advice do you have for parents who are reluctant to vaccinate their eligible children?
Dr. Watts.
I think this is a decision that everybody needs to make for their own family, and everybody needs to weigh out those risks and benefits. Our request is that you get the information that is truthful in front of you to make those decisions, that you find reliable sources, your pediatrician. You trust your pediatrician with your child from day one, and that's where you go to get all of your childhood vaccines. So COVID is no different. Have that conversation with your pediatrician, and then talk about it with your pediatrician and your family, and make the best choice for you. It's okay if it takes a little bit of time to do that, because we want you to do what's best for you and your family. But our request is that you get that truthful information and you have that conversation with your pediatrician.
And Dr. Megow at Research, I know you've got to echo this, but wow, when children aren't vaccinated and disease spread, it puts all that household at risk.
Yes, it does. And that, I think somebody mentioned earlier, when children are homesick, even if they're not sick enough to be in the hospital, their parents, many times are our nurses or other staff in our hospitals, and they can't work because they must stay home to tend to their sick children. So it impacts a large group. It's not just unique to childhood. And again, the impact on pregnant women and their unborn children is significant as well.
Dr. Stites, we're almost to the top of the hour, but I wanted to see if our guests wouldn't mind hanging around another 10 minutes or so. Is that possible?
As team, can we stay around? If you can't, I know you may have to drop off, but if you can, hang in there. We'll still turn to everybody.
Okay. Reva wants to know, is the rise due to Delta or the COVID strain, the new COVID strain?
Oh, I think right now, Hawkeye, it's really Delta as far as we know, and I know in wastewater testing we're still dominantly a Delta strain, and at University Hospital, Dr. Steele, is that still your story too? I think.
Yeah, no, absolutely. I think still, I mean, even across the country, it's predominantly Delta, but obviously Omicron is here and we're concerned about that. I did want to mention something. Dr. Schrimsher earlier talked about some limited availability of monoclonal antibodies, which is true, but I just want to point out on the flip side, we have plenty of vaccines. And so I would certainly urge those who have been on the fence about getting the vaccine to call us, and you shouldn't have any problem if you're interested in getting the vaccine or getting the booster, getting either one of those things. At both of our sites, we take walk-ins. You can call 404 CARE, and we definitely will get you in. So just want to encourage people to do that.
Yeah, thank you. That's a great point, and thanks for bringing that back home.
Joellen wants to know, is there anything being done to get the number of home tests more available and more affordable? She says everywhere she goes, they're sold out, and they're trying to do what you all are advising, which is to test more.
Hawkeye, I don't know the answer to that question, I don't think. How about you?
Yeah, a month ago there were plenty on the shelves.
Yeah.
I think as this has gone on, they've been bought up for sure. So I think that's a problem around the nation, though, is the lack of supply of that.
But let's remember that you can still go get tested somewhere else. You don't have to do a home test. There are clinics and places you can go. And we have to know, Dr. Long, I think, I'm sure in Olathe there are still places you can get tests.
Oh, absolutely. At all of our clinic spaces, we have testing available. And so, yes, it's very widespread.
Yeah, and Dr. Hayes, same thing in Shawnee Mission. I mean, we know there's testing out there that's still available when we still do some testing here with our nasal PCR swabs.
Right, exactly. Many of our primary care clinics can do it pretty readily. So reach out to your primary care doctor.
Amy is curious, as we talk about staffing shortage, are staff getting sick?
Okay, let's go. Let's have. That's a great question. Let's check in and let's see what's happening across our horn a little bit. Dr. Stewart, how about at North Kansas City? Are your staff getting sick?
We have some getting sick, but I think yesterday we had a total of 14 or 15 that were out because of COVID. But it's because we don't have the staff. It's not that they're getting sick. It's that we're short on staff across the board.
Dr. Petrash, VA.
Yes, we have 18 outs for COVID today, as of today, with active COVID. But I agree, it has not been a huge problem for us. Most of our staff have already got vaccinated, so that really helped.
Yeah, and I think, the good news, we've had 99% of our staff are now vaccinated and or whatever. There's an incredibly high number. And we haven't really lost a lot of people or any vaccine mandates. I mean, we around 0.5%, so that's not the issue.
Yeah.
The issue for us is that what we're afraid of. First of all, exhaustion plus Delta plus Omicron plus influenza plus not enough infection control out in the community means, yes, our staff are going to get sick, and that's going to cause trouble. Dr. Megow, your thoughts about that too?
Definitely. We actually monitor that pretty closely. We don't have a crisis at this point in time with our staff being homesick, but it is picking up some, and that certainly presents a really additional challenge for us, given the fact that we're already very short-staffed, and those who remain behind to work because they're not sick then, are really stressed even more, and it really does limit our ability to take care of patients. So it's always a concern. We continue to encourage all of our employees to be vaccinated, and the majority are. And of course, we are encouraging the booster vaccine as well.
Dr. Adiga up at Liberty Hospital, I mean, you've been on the forefront of a lot of this, and you're infectious disease doc. Talk to us a little bit about how your staff are doing. And also, like last week, you were talking about the impact you're seeing up in the northern counties of Missouri and how severe that's been.
Yeah, about the staff first. I mean, I want to give you a comparison between last December and now for our staff. Currently, we've got 12 staff who are out because of COVID, and vast majority are breakthrough infections. That's correct. However, a lot of these people, actually only one person had gotten booster, but pretty much everybody had not gotten the booster. And the key difference is that in last December, at the maximum, we had 48 people out. And not only they were out, they were sick. And these 12 people are not sick. They just have some symptoms. We don't want them to be working because we don't want them to spread the disease in the hospital to other people. So they are home. The difference last December was they were sick. and there were a lot more of them because we didn't have the vaccines then. So that's a huge difference. And for the past couple of weeks, that's been our really push here in the Northland, both for our staff getting the boosters. We had additional mass vaccination clinics for the staff. And then also trying our best to convince people in the Northland about getting their boosters, because our 65 and above vaccination rate in Clay County is only 75%. And that's way below the national average. And in fact, even below Missouri average. So we've had a lot of, the talks and trying our best to go to the media and use the, influencers to talk to them to go get their initial vaccines. And the booster rate, luckily, I do have some good news over the last couple of weeks. I think some things are working. People who got the primary doses, they're not against the vaccine. They just needed a little more nudge to go get their boosters. So what I've seen in the last 2 weeks in Clay County is that there's been about 4,000 to 5,000 booster doses that's been given in the past 2 weeks compared to what had been done all along, which was about 11,000 or so. We are at about 16,000. So I'm happy about that. These are the elderly and vulnerable who are going to get sick, and we need to keep pushing for that.
Okay.
Connie's curious, at what point would hospitals request help from the National Guard?
That's a great question. Let's just let's check with some of our folks. I mean, we've been able to staff this throughout. We're still able to staff all our beds, so I don't think we would go out and get to the National Guard for at least here at KU. But the struggle is going to be if a lot of our staff get sick with Omicron or something else, we may have to turn to that. But remember too, the National Guard's pulled nationally in many areas. Dr. Watts, how about at Children's? What would you think? You emergency preparedness.
Yeah, so in emergency preparedness and response world, we look at things with S's, right? We look at staff, stuff, and so staff, stuff, and space. And space, the National Guard can come in and stand up tents. We can probably all put up tents at our hospital if space is the issue. We can manage the space. The supplies, we've started to see some supplies come in. Monoclonal antibodies is a little short right now, but otherwise, we don't have the PPE crisis that we did back a year and a half ago. Staff is the biggest concern. And typically your first level in a crisis is that you start shifting your staff around. You bring back some of your retired folks. You bring in some travelers. You borrow from other areas of the country. And you use those temporary measures to help fix your staffing crisis in a disaster. We've been doing that for quite some time. So now you take it to another level. And at Children's Mercy, we've got, we've even gone so far to look at what our staffing crisis is going to be in January when respiratory season falls upon all the kids. And if we have this influx of patients, what that's going to look like. I can tell you our possibilities are extremely, extremely small right now, and we have utilized all possible areas. Pulling in the National Guard, pulling in other areas is definitely something we typically look at in the disaster world, but they're utilized everywhere right now. I mean, the National Guard's being deployed in so many areas across the country that there's only a finite number of them too. And so when you have a finite resource and yet your need is way beyond that finite resource, including the National Guard, including all of these measures we look at with staffing in a disaster crisis, we're not going to win this. And so we need to start doing what we can so we don't get to that point.
So that wraps up our community questions today. Again, I just want to thank all of our reporters for their great questions. Also want to give a shout out to our media partners, KQ2 up there, up north in St. Joe, Missouri, also KCTV5 here locally, KMBZ, and also KSHB 41 for streaming this and making sure that we're getting the very best accurate information out to your viewers and helping them stay safe. Dr. Stites, I'm going to send it back over to you to start wrapping things up.
All right. I want to say a big shout out to our Chief Medical Officers. Guys, you have been so terrific throughout this conference. In Kansas City, you are blessed with an amazing group of people who continue to work with us, and we work so well together throughout this crisis. I can't say enough good things about healthcare in Kansas City at all of our hospitals, all of our physicians, all of our nurses. You are in great hands wherever you go. Hawkeye, final thought.
Yeah, it's one thing, and it echoes everything we've heard today from our guests. When the first initial data came out about the Pfizer vaccine, We said vaccines work. What we know now, even with Omicron, the best up-to-date evidence says vaccines still work. The benefits of these vaccines far outweigh any risks that are associated with them. Please, if you haven't gotten your first vaccine doses, go get those vaccine doses. There is still time. If you haven't gotten your booster and you're in that criteria for booster, go get your booster. It is that pandemic now of the vaccinated versus the unvaccinated, with the unvaccinated making up the vast majority of those that are hospitalized and continue to die.
You know, I just, we're going to conclude here, but I have this couple final thought if I may. First of all, again, we are blessed by an incredible medical community represented by all these outstanding physicians and team here today. Special thanks to all of our staff, and thanks to all of our viewers who are listening, and to all the reporters. You know, these are hard times, and I know we are all tired of COVID. I'm tired of COVID. We're all tired of COVID. We're all exhausted. We know you're tired of COVID. Mm-hmm. And all of us want to let our guard down and have fun. But this is not that time, and this is not that place. We are at risk, and our community is at risk. Here we are in the holiday season when we want to have the expression of how much you love and care. The reality is the best gift you can give someone right now is that you respect and follow the rules of infection control, because you want them to be here for the next holiday season. There is hope on the horizon. Omicron may be coming, but so are new drugs. Paxlovid looks like a knockout home run. Antibodies, new kinds of antibodies that can stay in your body for 6 months, maybe a knockout home run. So there's some good things coming. But if we're going to survive to get to that point when that is in a meaningful supply, we have to take action now. And letting our guard down when we are at one of the worst points of the pandemic, and Omicron is on the horizon, and influenza is on the rise, this is not the time to quit. This is not the time to stop. This is the time to say, I love you, and to show it through the rules of infection control, which keep us safe right now, up until this moment, every day going forward, and travel with you wherever and whenever you go.
Well said, Dr. Stites. Thank you so much. And please share today's briefing with friends and family so that you all can stay safe this holiday season. And we do have something that we want to share with our regular viewers who watch us daily on our medical updates over the next 10 days. Starting next week through December 31st, we will continue to track the daily inpatient numbers for you. And you can find those on YouTube and on Facebook. On Mondays and Tuesdays, we will have special holiday editions of the Encore episodes from this time last year. So it will be interesting to compare and remember. On Wednesdays, Dr. Stites, he will be back. He'll be live in studio to update the COVID infection spread and also answer questions as usual. Thursday and Fridays, more holiday Encore episodes. So should there be a need for urgent communication, we will find you and we will let you know. So please stay safe, and thank you so much for joining us for this special news and community conference. Have a great day.